Yes, ma'am.
Yeah. So we are starting off with the upper face expression lines, because that is for the aesthetic purposes, aesthetic reasons, the face is divided into three horizontal zones: upper face, mid face, and lower face. So usually we always start with the upper face because that is the one that we are, whenever we are looking in the mirror, whenever we are looking at someone, and that is the area which expresses the maximum expressions. And that is the area individuals become more concerned about earliest in their aging, as in signs of aging. So we'll be covering the introduction, the consultation skills, anatomy of the area around the eyes, that is the periorbital region, effects of aging on the facial expression lines, treatment overview of Botox, injection techniques, and some potential complications. Right. So now the upper face is basically mostly judged and it's scrutinized because, first of all, whenever you talk to someone, it is your upper half of the face that you're looking at. Looking at eyes, and then indirectly it is the forehead also that comes to. So it is the aesthetic center of the face, and it is the area also where your age gets reflected. You can estimate the age of a person just by looking at their eyes and their forehead and the quality of the skin. And the region we use to judge a person's emotional state also. So the upper face has three purposes. It is, first of all, the aesthetic center of the face. Secondly, it is expressing our age. And third, it is expressing our emotional state also, right? So which is why it becomes very important to cater to concerns of the upper face. And another important thing is that it is the first area which will show the signs of aging first, because there is very little soft tissue and support over here. So the first area to show the signs of aging is basically the upper face, right? So the earliest signs of aging. Now, these signs of aging are basically internal, intrinsic aging and extrinsic aging combination. So it is because of genetics also. It is, second is because of repetitive facial actions, because we are losing elasticity. Now, when we are young, when we do an expression, make an expression, our skin recoils back to its normal because of good elasticity. But as we age, the elastic component, the collagen and hyaluronic component, they are reducing, and the skin is not able to recoil back, and which leads to formation of permanent expression lines. So initially they are mild, then they become moderate, and then they become severe if you don't take care of them. So repetitive facial expression is responsible for the formation of these lines. Then there are bone changes. In the face we have basically five layers. We have skin, we have superficial fat, we have muscles, we have deep fat, and then we have bone, right? So all these layers are changing at their different pace, but the changes are being reflected on the surface of the skin. The bone changes are being reflected on the skin surface. These muscle changes are being reflected on the skin. So the skin is basically a representative of all the changes, happening underneath. So the bone changes will be in the form of under eye hollowness. It will be in the form of sagging, because the bone anchors the ligaments, and since the bone resorption is there, the ligaments get loose, and then it leads to sagging. So all these bone changes. Then atrophy of the dermis and soft tissues. Now we all know that with aging, the thickness of the skin, it also starts reducing. The skin starts becoming thin as we age. So this implies that there is atrophy of the dermis and the soft tissues, the layers of the skin. Then again, due to gravity, everything is coming forward in the midline and downward. So which is why the center of the face, the middle one third of the face vertically is becoming heavy for most individuals. With aging, people feel that they're gaining weight. That is the impression they have. It's actually because of sagging. Because of sagging, everything is falling forwards and downwards, and this gives an impression that they're gaining weight, and their pictures or photos are becoming very, their face becomes very big in pictures and photos. And then there are certain intrinsic factors. Aging is going at its own pace, so that keeps on adding to all these changes. Now, other factors which will aggravate the changing, the lifestyle factors, they are smoking, photo aging, or sun exposure. Sun plays an important role. UV damage plays an important role in, the skin surface damages, in wrinkling, in fine lines, in dryness. So Solar elastosis is a condition which is very prominent, not in Indians and Asians, but in Caucasians, in Americans, in Europeans. You see very thin, crispy skin, that is called basically solar elastosis. So, photoaging and sun exposure is the reason for that. Then diet also plays a very good role. Like the study was done on two twins. One was staying in Caucasian countries, and one was in the Asian countries. So one staying in the Caucasian countries showed more fine lines and wrinkles as compared to the one in the Indian. And it was not because of diet, but it was because of the photoaging. But diet also plays a role in the quality of the skin. And then all the extrinsic factors that pollution and stress and all that lifestyle factors are playing all the, I mean, they are contributing to the all the signs of aging on the face, right? Now, people who are individuals who are coming in for aesthetic treatments, we need to make, I mean, they are educated, they understand. I think they have done their own surveys at the social media platforms. They take information from Google, they will take information from YouTube, and they're quite well informed. So, whenever we are treating them, we have to explain the link between this anatomy and aging. Only if we're able to do that, then only we'll be able to explain them why. Two things will have to explain: why these treatments need to be started, how they will help them, and why the non-invasive will, in the end, be more expensive as compared to surgical, right? And all other factors. Just a second. Hello. Yes. Yeah, good morning. Okay, no worries. I'll share another link with you after some time. I'm already in that session. Yeah. So now what happens? You need to explain, why you are doing what you are doing. Which is why, if somebody is coming for Botox, I'll just do Botox without explaining anything to them. They might not come back again. But if I'm explaining them that why it is happening and how it will help them, and Botox in first shot, you will give a conservative approach, and then actually in the subsequent sessions, you will grade up the sessions. So you need to explain and why this is happening. Now, patients often fixate on a particular area of the face. So their driving force could be either the horizontal lines, or it could be vertical lines of the forehead, or it could be under eye hollowness, or it could be jowling, so, or it could be smile lines. So these are the 3-4 main concerns which people come in for. They do not know the entire anatomy, they do not know the entire aging process. It is just one thing that is bothering them, and they will come to you for that particular concern. And they might not be aware of the relationship between signs of aging and the underlying anatomy. They might not be aware that the smile line is not just one line, it is basically the entire cheek area which is falling forwards and downwards because of the bone atrophy at the zygomatic level, bone resorption at zygomatic level, loosening of the retaining ligament attached to that bone. So we need to explain them that this is the area which needs to be addressed first. For treating the sign line, cheek is something which needs to be addressed first, followed by the smile line itself. So some explanations might be required, here and there, and we'll keep discussing the explanations as we come across each indication. Now, third thing, you have to understand that the aging is affecting the entire face. Although they are concerned about under eye hollowness, but all the other signs are aging. So the most pressing concern is the concern that they are coming with. So once you deal with it, then the other concern will start becoming more prominent. That is what, when if I'm treating someone for smile lines. So once the smile lines are treated, then they start seeing the marionette lines. Earlier they were not aware about the marionette lines. So if you deal with the pressing concern, once it's dealt with, then the next concern becomes an issue. So this is a process. So if you will explain it to them beforehand itself, that will help you establish your expertise. You can tell them that, one, we are doing this, but later on this might become prominent, so we can do this later. So that is how you extend your treatment plans also. That is how you prepare them before itself for the next treatments, whatever they can line up. So this also helps in building trust and establishing your expertise, which is very important when it comes to aesthetic procedures. Now then, besides facial assessment, you need to assess the, medical, you have to have the medical history, you need to assess the skin quality and the facial shape also. So overall assessment will include a medical history. You have to know what all, medications they are taking, what all ailments they have been suffering from, because that is somehow will be impacting either the treatment or the treatment plan in future, right? Then you might have lifestyle concerns, drinking, smoking, sleeping habits, stress levels. All these impact the face. After at the age of 30 or 35, if you haven't slept well, it's seen on your face. It's very obvious on the face. If you don't eat well, it is seen on your face. If you have if you have drunk yourself, make yourself drunk, or if you have had done smoking before, it's the face becomes groggy the next day, it becomes puffy the next day. So everything comes on face after certain age. It does not happen in the younger age groups, but after 30, 35, these changes start taking place. So everything is reflected onto the face, your entire lifestyle. Then another very important thing is the pain tolerance. You have to be aware of the how pain tolerant your patient is. Now this pain tolerance is very important, and I have also done a YouTube video on pain tolerance. You can just check my channel, that how to make Botox less painful. That's and this is something very important in aesthetics, because we do not advise a complete numbing or local anesthesia for aesthetic procedures, because pain is a very good indicator for us and to keep us in the safer zone. If we just inject lignocaine and make the entire area numb, we won't be able to know whether we are hitting the nerve or the artery. So pain is a good indicator of for doctors to be in the safer zone and to keep assessing, like whether we've hit the artery or the nerve. Because whenever you hit the artery, whenever you hit the nerve, there's slight wincing, and then it makes you careful to be injecting around that area. So pain tolerance is something very important. So what all you can do to, and also it is important to know the pain tolerance, because if you are injecting and the patient is making noise and they're howling and shouting, it is, I mean, your working space is getting disturbed, your head space is getting disturbed, you won't be able to focus on your procedures, and you will be in a hurry to finish the procedure just to stop that pain. So which should not happen. That is a very big mistake. Doctors, they finish the procedure in hurry bari, just to quiet the patient, just to make sure that they don't keep shouting. So if you know the pain tolerance and how to deal with it, it becomes easier for you. You're creating a clear space for yourself to do the injectables. So that is why pain tolerance is something very important. Now, some people are rough and tough. It doesn't matter to them whether, how much ever pain you can inflict on them. But then there's some people who are very delicate. And for them, you need to have slow injection. You need to have an assistant who can hold their hand. You can put, soft music. Make sure they're not empty stomach, because low glucose levels are known to, decrease your pain tolerance. Make sure they haven't had a fight. Make sure they have had a good day, because whenever you are disturbed, your pain tolerance reduces. So which is why it is good to communicate. Aesthetic clients will come and talk about their family, their friends, the problems that they're facing, everything there. So you have to be actively involved into their entire process, because that is what will give you an indication of the emotional, mental, and psychological state of your patient, which is very important while doing an aesthetic procedures, right? Because injecting is very easy. It is where anybody can inject. We are doctors, we can inject. It's so easy. But how to inject, when to inject, whom to inject, where to inject, that is what is makes you an expert in your field. Now, third thing is facial shape. You can analyze their facial shape, and although you cannot promise changing the shape, but you can always give suggestions on how your facial shape can be made into a more pleasant and a presentable and a youthful shape. So with age, the triangle of aging, there is called a triangle of youth. So what happens with age, the lower face becomes heavy because of the sagging, and the upper face becomes deflated. So this you need to explain, that we need to do some filler over here and some lifting over here, so that we can pull back the facial shape to a more youthful contour. Now, age and gender is also very important because certain facial features are different. Like chin is different, the forehead is different in men and women. The lips are different in men and women. The cheek projection, the chin projection, they're both different in men and women. And age is important because with increasing age, the skin quality reduces. So if I'm planning a treatment for a younger age group, like someone in 20s to 30s or maybe early 30s, I would not consider going for a skin quality improvement like volite, PRP, growth factors, and all. But if I'm dealing with someone who is above 45 or above 50, I would rather start with some skin quality improvements like growth factor concentrate or PRP or volite or vital first, and then go in for lifting and contouring. So that is how age will affect, because Botox is basically a procedure for people with good skin tone and good skin quality. In those individuals, Botox will give best results. If there is skin laxity, Botox is not the first choice for them. It is basically skin quality improvement procedures, which is the first choice for them. So once you've done 3-4 sessions of PRP, then you are good to go for Botox in that, if there is skin laxity. So if there is skin laxity present, go in for skin quality improvement first, and then you plan the other injectables, right? Now, skin quality will have, 3 components. One is the pigmentation. The other is the surface irregularities, uneven, tone. And then there is uneven tone, texture, and the volume loss. So skin quality is determined by these 3 factors. And now what people say, that earlier they were thinking that there are signs of aging which makes you look aged, but now they feel that skin quality is something which is more important as compared to 1 or 2 signs of aging. Now, if my skin quality is good, but I have just smile lines or marinette lines, it is okay. It won't be a matter of concern to me if my skin quality is good. So which is why they feel that skin quality is more important in reflecting your age as compared to the other sporadic signs of aging, right? So am I clear?
Yeah, ma'am, I'm okay.
Yeah. In case you want to ask something, you can always interrupt me.
Sure.
So you need to tailor-made the individual need. You need to, tailor down individual needs, their circumstances, their ethnic and cultural considerations, skin type, gender, facial shape, aesthetic requirements, etc. And then that is how you plan your treatments accordingly, right? Now, full face assessment. Now, once you've assessed the medical history, the psychological history, and all that, now you need to come to the face. Now, there's a 3-step approach to conduct a full face assessment. You need to, deal with the structural changes. You need to find out the volume loss, and you need to, locate the superficial lines and wrinkles. So, develop a plan that will deliver the optimal effect and most natural looking results. Treatment of one region in isolation has the potential for patient dissatisfaction, because what I have seen is individuals who are worried about their under eye hollows, sometimes they might not be clear what exactly they want. They will feel that the face does not have the same glow that it had before. Now they don't know that the lack of glow is a combination of a lot of factors. It is not just one thing that you are seeking to treat. Some people feel that if they treat their under eye hollows, they will start looking fine. But then after the under eye hollows are treated, the other things, smile lines or marinette lines or sagging, that will become a matter of concern. So it's the process, and you need to explain it, because they are just seeing one thing, but you are seeing everything in totality, right? But when you start your consultation, now this is one thing very important, how to begin an aesthetic consultation, because it is very challenging. Just imagine yourself going to a stranger and talking about your deepest concerns regarding your appearance. It's quite difficult to open up with that. So similarly goes for them also, so you need to create an open space for communication so that they are able to open up to you without the fear of being judged, right? So the way to begin your aesthetic consultation is ask them that what is the one thing that they want to get treated. You hold it. You first explain things around it, then explain the other things associated with it, and then start dealing with the one pressing concern they have. but make them aware of the other areas very strategically, right? So aesthetic, developing communication for aesthetic consultation is a skill in itself, and because different individuals will take your opinion in different ways. There are type A personality individuals, there are type B personality individuals, and I feel type B personality individuals are more receptive to your opinions, whereas type A personalities, they want you to pursue whatever they want to get done. So they're not coming for your opinion, they just want you to get things done. So personality also varies when it comes to aesthetic clients. Now, in upper face assessment for Botox, when we are doing, you need to photography skills. I mean, you need to first do the documentation and consent before you do the procedure. And in the assessment, you need to have the photography skills. Now, photography skills, you have to assess at rest and during animation, both for Botox. So first, at rest, you will take a front view, profile view, and oblique view, oblique right and oblique left, right? Then in action, making the action, raising the eyebrows, making a frown, and closing the eyes forcefully for crow's feet. So these are the three things that, you ask them to do before injecting Botox. And all these pictures are taken before and after. Then another thing at rest that you will observe is the position and mobility of the brow, the eyelid function, and presence of excess skin, the upper eyelid hooding. Upper eyelid hooding is very common in individuals above 40-45 years of age. So if that is there, that is not something you can improve with Botox. You can just slightly improve it, but not get rid of it. Right. And the third thing is volume loss in the upper face, like temple hollowness or forehead hollowness, you have to see. I have done another video on understanding the forehead. It's on YouTube. If you can watch this, it will be very helpful in understanding the mechanism of how Botox works, the mechanism of frontalis muscle, and all that. Right? And we can discuss it anytime in case you have a doubt about it. Right? So you have to evaluate at rest and evaluate in and during animation. The three poses should be the frontal view, the profile view, and oblique right and left. So these are the three. Photography, the background has to be either gray or white. Usually in the PPTs, it will be mostly black, but now what they advocate is it has to be either gray or white. The distance should be around 30 centimeters, or you can fix it according to you. If you're doing the photography from iPhone, choose a profile grid. So when you have the grid on the camera, you are able to, take uniform pictures. So this is another example of animation. You ask them to animate. Evaluate at rest and during animation. Assess the dynamic and static lines. Position, you have to assess all the asymmetries. Usually 5% asymmetry is normal in all the faces. And you need to, and with aging, this asymmetry becomes more obvious. People are usually not aware of these asymmetries. They start noticing these asymmetries only after they get injected for the first time and thinking that these asymmetries are caused by the injectables, but which is not. So any asymmetry that you see before the procedure, you need to take picture of that and make them aware about that this already is there, and this injectable procedure is not about creating symmetry. You cannot create, symmetry with injectables, because people will come asking for, sometimes they might know their asymmetries and they will keep asking whether you can correct it or not. So don't fall into that trap. We cannot, correct asymmetries with injectables. If it happens, it is by a stroke of luck. Otherwise, intentionally, you cannot do that, because muscle mechanics are different. The way they use the muscles on the right side and left side, the sleeping habits, the eating habits, all of these impact the muscle function and action, and which can lead to any kind of asymmetry which you cannot control. Right? Now, the consultation skills, the importance of patient consultation is very important. Now, what they say is like the minimum or the average time that you should spend on an aesthetic consultation is somewhere between 1 to 1.5 hours. That is the average time for the first consultation. Now, that is the time required to getting to know your patient, getting to know the person you are injecting. Usually, we all are in clinical practice, and we are just giving prescription medicine, and the maximum time that we get to spend with any patient is not more than 5 to 10 minutes. But an aesthetic client is completely different, because aesthetic medicine is completely different from clinical medicine or prescription or hospital medicine, right? So aesthetic client needs, it is their need, it is your need also, and it's their need also, to be understood properly, what you are doing for them and what they're expecting and what they actually need. So this was a topic of discussion in one of the big conferences which I recently attended, and there it was like, it was a common opinion that the minimum time they spend in an aesthetic consultation is at least 45 minutes to 1.5 hours. That is the average time every doctor spends, and your aesthetic clients demands of that time. You cannot deal them in rush and hurry burry. So consultation process provides important opportunities for discussion. It is the key insights from women show that there are many factors that influence the decision they take to seek the treatment. Now, why it is important for you to know that why they want to get the treatment done? Because that is how you will deal with the treatment. If you have to assess if the reasons for them getting the treatment done are right, then okay, go ahead with it. But if they're getting it done for the wrong reasons, like if they think that their love life will improve, if they think that they will have more authority in workplace, so you need to keep counseling that it is basically just enhancing your confidence, which finally will ultimately help you handle other factors. It will not directly per se help you deal with anything. Getting Botox done will not improve your relationship with your family, but it might empower you with the thought process or with the mindset that you're able to deal with. So it is important to know their perspective of or their influences for seeking the aesthetic injectables. So a good consultation can overcome barriers and create long lasting relationships. So the more you converse, the more you get to know them, the more long lasting relationship you will have with them. And aesthetic is something, if you do it once, they will need it for the rest of their life. And usually patients do not usually change their aesthetic doctors once they are comfortable with one, unless until something mishap happens, or unless until they feel that they've not been understood well. So building trust and establishing your position of expertise by, you have to determine your patient's individual motivations, like what is their motivation. In my practice, I'm getting individuals from all fields. Now there are females who are coming because their children are asking them that why don't you get something done, why don't you take care of yourself. They themselves do not have any concern, but their children are asking, their children are bringing them, their children are forcing, please do something. So now they don't know what is hollowness, what is smile lines, what is marinate lines. So they come to me and they say, my daughter has brought me here, now you tell me what I can do. So that is their motivation. Sometimes there are models and actors, their photographers or cameramen they will tell them, okay, you need to work on your cheek, or you need to work on this angle or that angle, or you need to work on your profile. So that in that case, it is their motivation. So then you have to make sure that if they're coming for some photogenic reasons, you need to deliver a photogenic result. So the motivations are very important to know. Then there are some men who are coming. They just want to feel younger in their workplace, because they're working with younger subordinates, and looking older makes them, underconfident, and makes them feel that they're not, authoritative enough. So that is their motivation. So different people will have different motivations. And another thing is that you have to alleviate concerns or fears. Now their fears could be anything. The fears could be about the procedure, their fears would be about the product that you're putting in their face, their fears could be about you, whether you're the right person for them or not. And their fears would be that will they be judged, or will people get to know that they've gotten something done after. There is a whole spectrum of fears, starting from A to Z. starting from just getting to decide the procedure till going on to getting the procedure done and moving out. The most of the individuals coming to me, now Jaipur, I'm in Jaipur, Rajasthan. It is a conservative place. So most of the people have the fear that if we go out, nobody should be able to find out that they've gotten something done. So that is their major apprehension, basically. So I need to do it very naturally, very subtly. Even if I have to divide the session in two, 15 days apart, in two sittings, I have to do it like that way, that nobody gets to know it. Now, and then the third, alleviating concerns and fears is important. Performing a full face assessment is important. Their concern would be one, but everything else is unseen till it's not becoming obvious. Then advancing your patient's knowledge of facial anatomy. In your discussions, in your consultations, you need to keep educating them also. So you have to collect tools also. So like I have kept a skull also over here. I have kept some, pictures that the companies provide, MD codes. This chart is there. I'll share the picture. It's not seen over here. So some pictures or consultation tools which will help you explain like for example, under eye hollowness. You can take down pictures from the net and explain them that the under eye hollowness is something very common and it happens in all the individuals sometimes. Then their malar mound is there. So in malar mound, again, you need to explain them. It is something very common and it happens in all the individuals after certain age. So you need to keep educating them on anatomy also, little by little, not everything in one time, but just little by little. And then creating an individualized holistic treatment plan, right? Then identifying additional treatment opportunities. Again, when I say that if you're dealing with smile line, you can always prepare them for getting the marinate line done in subsequent sessions, because then that is, so you are identifying additional opportunities for treatments which will ultimately end up in good results. And tailoring your consultation style to suit individual patient needs. So everybody, although with MD codes and all, it has become very easy to do the consultation to treatment planning and to explain it to the patients. But again, some things you need to assess on of your own. So it provides important opportunities for discussion. So in a consultation process, you have to determine your patient's motivations. You have to address their key concerns. You have to assess the desired treatment outcome in context of the full face. And then you create a treatment plan with achievable goals, overcome any misperceptions or barriers to treatment. Educate them on the process of aging and the underlying anatomy little by little, and identify additional treatment opportunities. And which is why aesthetic consultation needs at least a minimum of 1 hour, because these are all the things that you need to do. Because the more clarity you have into the insights of your patient's concern, the more you will be able to deal with the results in a better way. The